video will show you how to place a referral to a specialty. So at the bottom of your SOAP template is the assessment and plan section, and on the left-hand side is the referrals hyperlink. Click that, and it will open this referrals order page. One thing to note, you must have an assessment prior to placing a referral. Click the radio button next to specialty, and in the specialty box, there is a drop down of most of the specialties that you will be referring your patients to. So pick cardiology. If there's a particular cardiologist, for example, sometimes those practices are listed under the provider name. So if I click here, I can see that SMHC, Mercy, MMP, and some internal cardiologists are listed here. So you can choose to use this, or you can choose not to. Once you've picked the specialty, you're then going to go into diagnoses. Click on the first box, and it will pull up the current diagnoses. You can pick the appropriate diagnoses, and then pick consult, or in the case of some specialties, if you wanted to do a diagnostic study, you could click that as well. There are some options in the reason for referral, so if you click that box, you can choose some options. If, for example, it's a Holter patch, a Holter monitor, Zio patch, or an echo, you could place that in the clinical indications. In the clinical information and comments, this is where you are going to give the clinical history, which is behind the reason for referral. Okay, so let's say that is our indication. Once you have these fields completed, you're going to do add, and then send it to the referrals department. I'm not going to do that in this case. Once you do send it to the referrals department, it will show up here in the referrals ordered. Close this. I'm going to also show you how you might order a referral through the provider test action. So if you've gotten a consult note or an ER study, an ER visit or a study done that requires you to place a referral outside of an office visit, you can do it through the provider test action. So here we are in a provider test action, and here's referrals. So click on referrals. It will show all the referrals that have already been made. If you wanted to add a referral, simply click add, and there you are back in the same template that you previously were in when you added a referral from the SOAP. Again, important to note, and especially when you are adding a referral outside of a visit, you must have an assessment prior to placing the referral. So in this case, if it were a provider test action that I am ordering a referral, I have not seen the patient today, I'd go to assessment and just make sure that the reason I'm placing the referral has been added to an assessment. Okay? Wonderful. As always, if you have any questions, please contact us at nextgenhelp@greaterportlandhealth.org.